Well, welcome everyone back to the Yosan University 39 Gen podcast. I am here with an awesome guest today. Now, would you like to tell me who you are and a little bit about what you do?
Sure. And thank you, Sean, for the opportunity. I'm Dr. Joe Sanfilippo. I am a reproductive endocrine infertility specialist. I'm at the University of Pittsburgh School of Medicine. I have truly dedicated my career really to infertility patients. That's my area of focus. And of course, that's all encompassing everything from the medical, surgical, IVF arenas. So that's who I am. I'm more than happy to share with you kind of background how I got here, but I'll leave that to you.
That's awesome. Well, very interesting. And I would love to know, how did you go down this path? How did you find this specialty?
Yeah. Well, everybody has I guess I'd say, somewhat unique story. So I always was interested in obstetrics and gynecology for whatever reason. And some of the highlights to me are I went to med school in Chicago. And when I was a fourth year medical student, I had the opportunity to really work at the Chicago Medical Center. Why I tell you that is that was, and this was in the 70s,
Hmm.
um, we would go to to the patient's home and deliver the baby. And it was
Wow.
a nurse and the medical student. And if there's any way to learn obstetrics and kind of develop some self-confidence, that's it. So it was an incredible experience. Matter of fact, I took one of my med school roommates on one of these ventures. And after the delivery, the family had a cooked dinner and have a big celebration. And he was so impressed. He went into psychiatry, but that's another whole story. So that's that's a little bit about, let's say, medical school. Um, I did an internship, which was by design really medicine and surgery at what is now Medical College of Wisconsin. And then I did my residency at State University of New York Upstate Medical Center, and that was in Syracuse. And when I was a resident, residents either decide they want to do general practice or they want to do a fellowship, a subspecialty. So I was especially impressed with one of my mentors who did infertility.
Hmm.
And he was certainly a big influence in my decision. And from that, I went to the University of Louisville School of Medicine. In the 70s, fellowships were just starting to get organized. I mean, we're on the ground floor here, if you will. And then it was a 2-year fellowship where you learned all about, again, reproductive endocrine, the hormonal aspects, the surgical aspects. We did a lot of microsurgery. Excuse me, if a woman could not get pregnant, we would, let's say, and it's because of a blocked fallopian tubes, we would operate and we would open the tubes because that's all we had to offer. Excuse me, we didn't have in vitro fertilization, which has replaced virtually 100% all of that surgical opening of a blocked fallopian tube. And, and then, we would do intrauterine inseminations, which still are done today. Let's say a man has a low sperm count, or there's some other barrier for the cervical mucus, for instance, comes to mind. The sperm cannot penetrate. They can't get to the end of the fallopian tube where fertilization occurs. So you take the sperm mid-cycle right around ovulation and put it right in the uterus. And that's what we had. We had medications to develop more than one egg. We had shots. We had pills. I'm sure the everyone in your audience has heard of Clomid. Clomid is a pill by mouth that enhances ovulation, and we use that to this day. So that was, fellowship and so on. And then in our specialty, things evolved, and really it was the late 70s. Doctors Edwards and Steptoe, and they are incredible pioneers, Nobel Prize winners, presented at a national meeting their work on in vitro fertilization in England. and that was the
Mm,
very first test tube baby. And today we have over 8 million test tube babies. I'm a little naive, but I think that's just incredible. None of these babies would be here today if we didn't have the pioneering work of those gentlemen, and the technology has just skyrocketed what the laboratories can do in terms of embryology and what we can offer to patients.
that's amazing. It's amazing that how far we've come with this medicine, and to see that it's still progressing very rapidly. Where do you think things are going to be going?
Yeah, that's a great question. I would want to answer that question in two aspects. First of all, realizing that, well, and let me even back up a little more. So let's just say an individual couple are trying to conceive, and
Hmm.
the woman is under 35, and it has not happened with 1 year, and our buzzword is unprotected intercourse, no birth control. Um, so that defines a problem. So if you're a woman under 35, you've been trying for a year, it hasn't happened, you need to get to the specialist, the reproductive endocrinology infertility specialist. If you're 35 to 40, you want to shorten that to 6 months. If you're 40, you want to go right away. Time
Yeah,
is of the essence to the reproductive endocrine specialist. At the end of the day, the age of the egg in the ovary is what it's all about. If it sat there 30 years versus 40 years, and even if I tell a patient, hey, look, everything looks great, the blood test that looks at your egg supply, your tubes are open, your uterus looks good on ultrasound, but you're 40 years of age. The genetics of that egg does not work like it did 5 years, 10 years earlier. And the chances of miscarriage and Down syndrome are higher. So one very important point is if you can't get pregnant, say something, speak up, seek the care. But I haven't not answered your question. Where are we
no
going?
problem.
Well, it's very interesting. We have Thursday is our big conference day at our university in our own infertility division, and there's a very astute embryologist PhD there, and we had this very conversation. And the take-home message is AI is going to have a very profound effect in terms of the laboratory and where we're going, and this is going to complement what we're doing. I always say to a couple, if a man has a very low sperm count, give me give me a handful of sperm and we can create a pregnancy or can have a pregnancy. Why? Because the embryologists have the ability of injecting one sperm into one egg, and it
Mm,
gets fertilized and it progresses from there. And even if a woman has a low egg count, I should say, we can give her injections, which we usually routinely do with any IVF cycle, to get not one egg, but I always say 10, 12 eggs, whatever we can get. And then we can work with those eggs. They're not all mature, they don't all fertilize, they don't all turn into embryos, but it's a start. And I want to complement all of this conversation by saying there is, stress. The daunting journey of infertility is incredible. And why I go there is because acupuncturists, complementary medicine, and to some degree herbal medicine play an important role, in my opinion, in terms of care for couples, both men and women, in terms of stress management, in terms of what can be done. So I think as we progress and where we're going is going to be more of a team effort that will clearly include acupuncturists, and herbal medicine, and it's a team effort.
that's amazing.
Yeah.
It's awesome because at Yosan, Yosan has a really great doctoral program that focuses on reproductive health. Um, how has it been for you to interact with that program and Yosan students?
Um, I was invited at the most recent symposium. And I was invited to give a lecture, which really was on pain and pain management. And obviously, I came from the Western medicine approach. Well, I sat in that audience for a weekend, And I have never been at a conference that has changed my lifestyle since then. And I'm very sincere when I say that, meaning if you look in my cabinet, there's herbs and there's things that I never would have imagined, okay? Not to even include in the conversation the acupuncture segment, which, is unbelievable. And as a reproductive endocrinologist, to learn what you all bring to the table is incredible. And I have a big campaign to educate my colleagues because we need to work as a team here. And along this line, I had, having spent my entire career, I also felt there's a need to educate patients, and that includes things like complementary medicine, et cetera. So I wrote this book, which I happen to have here, which is but, essentially, it's the expert guide to fertility, boost your chances of pregnancy. And in that are case histories of patients that I've had, and it addresses every problem. Let's say fibroids, endometriosis. Here's a case presentation. Here's the evaluation. Here's the potential treatment options. So the reason for that is that the patient can go to the doctor and with an understanding of what the assessment is and what the treatment options might be, and ask what I say are intelligent questions, meaning, it shows the doctor or the healthcare provider, I mean, physician assistant, nurse practitioner, whomever is involved with their care, that they are educated in their own problem. So that's been well received.
That's awesome. Well, talk to me about your book. How did you go about what was the catalyst for you to write this book, and what was it that, said, "Hey, this is a book that needs to be out there?"
Yeah. Well, very good question. There's not a infertility doctor that has not heard the term from the patient. Well, I Googled
Mm,
so and so. I went to Doctor Google, and usually it comes with an apology. There's no reason for a patient to apologize, but I don't want to say misinformation, and maybe the level of information is hard for the couple, and I'll say couple, to acquire. And so I had this thought, and what I did was work with then Dr. Artie Kumar, who was a medical student, a fourth year medical student, spent a month with me. I was so impressed with her, her work ethic, her knowledge base. And I said, Artie, this is my idea. So the two of us put it together. Why I'm telling you this is the goal is to have a ray of hope. I like to say light at the end of the tunnel. The very
yeah.
first chapter is a Christie's story. And Christie's story is about a woman who had a low egg reserve, decreased ovarian reserve is our term. And she shares all of this in the book, in the chapter she wrote. And she went from one IVF center on the East Coast to another IVF center and ultimately wound up towards the West Coast. And
Mhm.
finally, she wound up with we call it a protocol, what worked in terms of the injections and so on through an IVF cycle. And she got really, I think it was 3 or 4 embryos.
Wow.
How frustrating. And she shares with you, what it's like when the office calls and I'm sorry to tell you your pregnancy test is negative. I mean, every time I
Wow.
think about that, yeah, exactly. My heart goes out to all of the patients who get that call. But then she persisted. This was her dream.
Yeah.
And she shares in that chapter, she spent $250,000 on this
Wow.
mission, but she has 2 IVF babies, and she is the happiest person in the world. Exactly. And I always say these IVF babies are premium pregnancies, premium babies. They're I don't know, they enter the world in, with a lot of positive aspect. That's just my bias. So
Mm,
that's one example. The other things I felt, well, and let's just say you're in the military.
mm,
Military is very frustrating because there's a lot of barriers to access infertility care. Well, this is kind of a roadmap, how to work through that and how to get infertility treatment. And the good news is there's been some, encouraging financial support for the military. And the people who defend us, my gosh, they should be at the
Right.
top of the priority list. Another example that comes to mind is same-sex couples.
Hmm.
What do? And this is how you would identify a gestational carrier. Or sometimes there's a lesbian couple and one wants to be the egg donor and the other wants to carry the pregnancy. And all of these things we can provide, I even say easily. So those are some of the things that I really wanted to address. And there's also the stress of going through it. You have to, and here's where Yosan graduates and the ABORM folks come into play, because they can help patients again with the stress and with all of the details, um, and bring something to the table. So those are some of my immediate thoughts.
It's amazing. And,
Yeah.
it's stress is such a challenging thing in everyone's life. You go through your day, you wake up, and the world can be daunting. And,
Absolutely.
to compound that when you are dealing with other things or you are trying to, get pregnant, there's just another layer. And so, I think that people don't recognize as much how powerful it is to be able to work with those aspects. Because I remember once we had this, it was not a fertility case, but we were at the clinic and it was this big type A gentleman who came in and got on the table, and he was directing us and telling us, this is how I never relax. My wife sent me here because I just, I got high blood pressure. I've got this and that. Put him on the table. The man slept for 45 minutes like a baby. And he just looked at us. He's like, I can't sleep at home. I can't sleep anywhere. I've never had that happen. He's like, what did you do? And, like, well, that's kind of the power of acupuncture. And the person became a regular.
Oh,
He came back to the clinic every week. And, what was amazing and powerful is we were treating his stress, but his blood pressure started to balance. His other conditions that were underlying started to as well improve, and the guy became an absolute, um, absolute poster child for acupuncture. Sharing with all his friends, he sent so many people to the clinic. It was so powerful to see that this one person who was overwhelmed, we were able to make an impact for, and they brought in so many other people. It was powerful.
there's no question. Actually, one of my other interests is business of medicine, because I have an MBA and so on. And I just happened to give a lecture really earlier this week, and lessons from the business world. If you have one happy patient
Yeah.
customer, they'll tell four or five. You have one unhappy patient customer, they'll
Yes.
tell nine. Right.
Yeah.
And you're so on target with that. And that's what it's all about, patient comes first concept.
Hmm.
And that individual is a great example. It's funny you mentioned that, because a couple other things came to my mind. One of which is a couple had a baby and then were trying to have a second baby and it wasn't happening. And to fast forward, we do a history, physical exam. He had a sperm count. We needed to do some blood tests, and his sperm count at this point was zero. Now that he
Wow.
had a baby with his wife, and finally he confessed, "I've been taking anabolic steroids,"
Oh,
and
wow.
it not only lowered it plummeted. His sperm count was really so incredibly low. Of course, that was an easy fix. Stop the anabolic steroids and wait 74 days or so, and you're back in business. So that came to mind, but he never shared that with his wife. And I thought that was interesting. The other thing that came to mind is Dr. Colleen Smith, who is president of ABRM, and I'm sure totally familiar to everyone in the audience. And I were just talking about a paper about acupuncture and IVF, okay? And the end product of this, this was a study from China, multi-center, et cetera. At the end of the day, depending on the category, let's just say it's unexplained infertility, which is the most frustrating diagnosis a couple can have. If you added acupuncture, you had higher not only pregnancy rates but live birth rates, and that's the way
Mm,
we talk. Pregnancy rates are great, but at the end of the day, we need a baby. Okay, so acupuncture in different categories. It didn't work real well with polycystic ovaries
mm.
because it's such a complex endocrine problem. But other categories it did. So, there's clear data that, you know, I always said the graduates of Yosan and certainly all the ABORM certified uh, uh, acupuncturists, et cetera, need to, you know, take the initiative and knock on the door of the reproductive endocrinologist and say, let me tell you what I can bring to your practice. Let me tell you how I can even enhance your success. Okay. So it's very interesting.
Which leads to my next question. How do you see um, we start bridging the door between East and West even more? Because it's something that, I know that in the acupuncture community, there are people who um, feel overwhelmed by knowing how to reach out, how to approach the endocrine reproductive medicine specialists. But how do we start bridging that gap?
Great question. And I wish I had a succinct answer. And one more time, Dr. Smith and I had the opportunity to talk about this. And some of the key things are, um, I always say the back door is to look at or contact the office nurse and just
Mm,
say, hey, I'm here and I would like to have the opportunity to do a learn and lunch or lunch and learn, whatever it is. Um, I would like to have the opportunity to um, do a PowerPoint presentation. Okay. And that's some of the things. And what I learned today is ABORM has a number of very pertinent articles on the
mhm.
website, okay, that you can download and maybe summarize, okay, and then share your experience as an acupuncturist. Just like you said, you gave me the example of that gentleman, okay, all right. Then I can give you a number of examples of stress reduction, okay, and how
Mhm.
people come to the acupuncturist and say, "This is what the doctor said. I really want to know, your perspective, okay? Because you have this rapport that's developed." So what I'm saying is that if you have, and I'm totally encouraging every Yosan graduate, every ABORM certified acupuncturist to bite the bullet and take the step and knock on the door. Okay. So, okay, if they say no, they say no,
Yeah.
but at least you've tried. And then you make it turnkey. This is what I'm going to provide for you for the front desk. So you can hand this out to the patient, how to contact the acupuncturist. We have different programs that are that start before you start an IVF cycle, in the middle of the cycle, or just at the embryo transfer, all these different things. And then, of course, it varies based on the insurance coverage. And I'm delighted to see that there clearly is insurance coverage for acupuncture in many states. So all of that can concisely be put together, ideally in a little PowerPoint presentation. And to me, you see if you can talk with the nurse, because the doctor might say, I'm too busy, blah, blah, blah. But if you convince the nurse that she and her colleagues would be a great, audience, that's my suggestion. Yeah.
That's awesome. When it comes down to, and I do want to stay on the topic of fertility, but I also want to, um, I took a sabbatical from acupuncture school and went and did my MBA. And it was one of the,
Super.
yeah, I loved it. And one of the things that was
Mhm.
interesting was looking at business. And I think this is something that, because you had talked about the business of medicine, we tend to think, I think there's like a general idea that, well, doctors are doctors, you're already going to have patients, acupuncturists, you're going to, but there is so much involved in, knocking on doors, whether that be a literal door or it be, just finding ways to do outreach. And you see some people that are doing exceptional jobs of this, whether it be through social media or through their content. And, this is part of the reason we have this podcast, is to spread awareness of acupuncture and to spread awareness of this medicine. But there is a lot that can be done as well. What do you think the kind of the mindset should be of people trying to grow, trying to spread this out there, whether that any type of medicine? How should people approach the business side?
Marketing, marketing 101 is the way I
Right.
look at this, and I have several suggestions. One is Resolve. Resolve is, as many people know, a national infertility, I always say, entity. They're virtually in every state. And you can look at the Resolve group in your own area. Well, like right now, there's Walk of Hope, which is in many, many states. It's during Infertility Week, and they have a walk, and they have a raffle, and they have some lecturers, etc. So linking up with Resolve is one way to market your skills, because they frequently, at least the one locally, periodically puts on programs that you can attend live or by telecast, whatever.
Hmm.
And it would be great to have an acupuncturist talk about that, and that should make you comfortable, because you're talking to patients. You do this all day long,
Yeah.
and so Resolve, you know rise it to the top of my list. Now, other things are, you need to have some good materials, handouts, so they know how to easily get a hold of you. Okay.
Yeah.
And then, like I said, marketing should include, here's the program. Um, I always say, I've gone to chiropractors and say, for $100, you get 3 treatments, that
Yeah.
kind of thing. Yeah, exactly. And those are the innovative ideas that I think are worthwhile. But marketing your all services is something that really needs to occur. The other thing we talked about, Dr. Smith and I, were that the American Society of Reproductive Medicine, ASRM, and the Pacific Coast Reproductive Society, whatever, um, have like special interest groups for acupuncture and so on, and sharing with the nursing team that you're talking with, the reproductive endocrinologist, hey, this special interest group addressed this, that, or the other thing, and this is readily available, because this is at the level of the reproductive endocrinologist. This is our big national society and meeting, and to have a special interest group, and you share some of the results of that,
Yeah.
it catches your attention.
I
Yeah.
love that. Well, coming
See,
back, that leads me into another question about if you're an acupuncturist and you are working with patients, that are seeking fertility, what are some of the most important things that you can focus on to really help your patients get results?
yeah. Well, I think some of it is that it's gonna be several sessions, okay? I mean,
Hmm.
in all probability, and developing that rapport. We had an
Yeah.
acupuncturist that would go to, our embryo transfers, and she was excellent. Um what I observed is that she created this environment where, um, the patient knew they could go to her and get a very reliable answer about whatever. So number one is establishing that patient provider relationship. Very, very important to me.
Hmm.
Number two, one of my other suggestions is back to the symposium at Yosan that I attended. It was very revealing to me to learn all about kidney and quai and I always say the 30,000-foot view of complementary medicine of TCM. Okay, so that's another thing that the acupuncturist should be able to succinctly say, These are the services that we can provide, and let me tell you very briefly how acupuncture works." That
Yes.
kind of thing. I found that fascinating, and it was an education for me that I would love to have you guys share with my colleagues. So,
I think that education is so important. And I think that, like, now there are so many studies coming out that have shown the
yeah,
power of this. And some people, one of the things I think that is two of the things that are really powerful is getting people in the door and giving them. I remember that a friend of mine um, got in with a reproductive endocrinology center, but they went through the nurses. They said, "Hey, you look stressed. Come in for a treatment. I want to show you what the power of acupuncture is." And a couple of the nurses became true believers. They're like, you know what? I have had so many great results from this. And they got the doctor in. And it was like this connection that was built, but it was built organically. There was nothing forced. It was nothing salesy. It was just like, you know what? Let me help you. And the people's results spoke for themselves. And I think that that's so important that you have to make people believers, you know?
yeah. Oh, agree with you. And it is added value to the reproductive endocrine service or centers array of services. Okay, it is. And like I think about major cities, New York, Chicago, where there's many programs. Okay, you have to, again, marketing 101, be a step ahead, know your competition, those kind of things, and providing this service to a practice that doesn't have it indeed puts them a step ahead of their competition. And you have to convince them of that. Okay. And I think you can.
Yeah. I love that. You had mentioned there was another book that you had written. Can you talk to me
Oh,
about that book as well?
absolutely. This is called Everyday Medical Miracles. Now, what this story is that there's another OBGYN doctor, Dr. Kerry Andrew Jaja. And I contacted him actually over 2 years ago now. And I said, Kerry, I have this idea to provide a book of all true stories by healthcare providers. So we have in here physicians, nurses, PAs, nurse practitioners, doulas, a medical assistant that share their most interesting patient. Okay. For instance, um, one of my experiences was I was on call as a resident, and the nurse looked me on the door of we were sleeping, whatever, and says, "Doctor, you got to come quick." Okay, so
Mm.
long story short, we're at the elevator from the 10th floor down to the parking lot, and says, "A patient called, and she's in the parking lot. She feels." She's had 2 other babies, and they're very fast labors, and she doesn't think she can make it up to labor and delivery. Where I'm going with this is I delivered the baby in the front seat of the car, okay?
Wow.
And, what was very interesting, it was, I think it was a blue Buick. Don't ask me why I remember that, but the husband kept saying, "My car, my car." But we put some towels on the seat and everything was fine and, no bad events, but it was just interesting in there, and then I ultimately, excuse me, caught up with the attending physician and of course, he's thanking me, and he said when the patient called him when he was at home, he said, "Meet me in this parking lot." So he was in the wrong parking lot,
Oh,
and I
no.
got to do the delivery anyway.
Oh,
It was
wow.
I mean, but that and the other thing, for instance, you talk about the stories. There's a colleague of mine who's now at University of North Carolina, and he went to school in Mexico. And in Mexico, when you graduate, you have to do 1 year of service. So he was on his service mission, and this husband comes knocking on the door of the clinic and says, "My wife's in labor," and so on. So this is a very remote area in Mexico. And so the doctor says, "Well, we'll bring her in, we'll get the ambulance." And there was one ambulance, and that ambulance was on another call. So, bottom line is, he had to do this delivery. And he says, I can do it. This is my first delivery all by myself. So he ultimately does the delivery. And about a week later, there's a knock on the clinic door. And the father, the husband, comes in and says, "Doctor, I want you to have one of my goats, because this is a very special thing for me to, we raise goats and so on." So the doc said, "What am I gonna do with this goat?" The nurse is pulling on his white coat. "Take the goat. I mean, you gotta be polite." He takes the goat, so on. And they invited the doctor to the baptism of this little infant boy. And at the baptism, they announce they're gonna name the baby after the doctor.
Oh, wow.
To me, I think that's so cool every time I think about it. So this book is, let's say you had a hard day in the office with patients. It's designed to put a smile on your face. They're all true stories. Um, and it's just interesting. Uh, so on. I mean, I'm happy to share other stories, but
No,
let me
it's
turn it to you.
I love it because also, I think that going back to the earlier things, life can be challenging, and there's a lot of stress that we all deal with. And sometimes the thing that we need to all remember is that little spark of hope, that little spark and belief that, there are these everyday little miracles that happen around us, if you want to call them that, these beautiful synchronicities and these beautiful stories. But you have to remember to keep that hope.
You are so on target. That brings to mind a nurse in my office wrote a story about the little embryo that could. And to fast forward, this couple has spent all their money on IVF, and this was it. And they had one embryo,
Wow,
and it was all or none phenomenon. And lo and behold, they have a little baby to this day.
that's awesome.
So that to me is the ray of hope. The other story that comes to my mind is when I was a resident. Understand that in the 70s, or late middle 70s, we didn't do ultrasounds with every pregnancy like we do today. And so um, this patient was in labor, and I think they had two other girls. And it was very obvious that she needed to be delivered before the attending doctor could get to the hospital. He was en route. So I say to the nurse, we used to have the patient labor in one area and then deliver in a different area. I said to her, "We need to get the patient from labor to the delivery room. Go to the delivery room." And then husbands were not allowed in the delivery room, but they could stand at the doorway. Okay. So I deliver the baby, everything's going well, and the husband says, "Well, what is it, doc?" And I said, "It's a girl." And he says, "Oh." He was so disappointed because they had two girls. And so then he looks at me and he says, "Everything okay, doc?" And I was there with another, like a family practice resident. And he said to me, the resident, "I think there's another baby in there." And so, go in there and feel around inside the uterus, and lo and behold, it's just another baby. So the husband saying, "Is everything okay?" I said, "Yeah, but I think there's another baby in here." And so he immediately says, "You mean I have another chance for a boy?" I said, "Yeah, you do." And so we deliver the baby, and I always say, "I'm not going to tell you how it turned out. You got to buy the book." But to go in the hospital assuming you're going to come home with one baby and to walk out the door with two babies, unpredicted or unpredictably. Um, every time I think about that, it kind of brings a smile to your face, something like that.
It is. It's beautiful. It's like, and I think that's, you know, as acupuncturists, we also have to look at specialties, and people are looking at different areas and different niches that they can go into. And some people like sports acupuncture, some people like,
Right.
facial acupuncture. There's all these different specialties, but I think one of the beauties of fertility medicine is the joy that the results bring. It's the power of someone who has longed for something for so long, and then you have a part in. I talked to Dr. Smith the other day, and she was telling me some stories about patients that, you know, came out with so much joy when they were able to conceive. It was powerful.
And let me tell you that just my little association with Dr. Smith, meaning meeting her at the symposium, and we've had a couple of there's a podcast we did and kind of collaborating on some things. It, well, she's a typical example of the enthusiasm she has for her patients is incredible, and the rapport she establishes is incredible, and she's a model that I think virtually all of you, you know, have the same approach. And in patients, I just think, your physical presence is is a stress reliever. I mean that very sincerely because they've gone to you for several acupuncture sessions, whatever, and they know you know them now, and just your mere presence, and you're so on target, incredibly, and it is definitely satisfying. And I always say, we all go out and celebrate. You, the couple, and we the infertility program. Whenever there's pregnancies, and it's fun.
I love that. If you could go back in time and give some advice to a younger version of yourself about this medicine or just about life in general, what advice would you give your younger self?
Oh, I always say follow your dreams. I mean, very seriously. And the more I get to work with, seriously, Yosan and the ABORM, I guess I have to say certified acupuncturist. It is to me that when you're in whatever grade school, high school, and you don't know what you want to do, explore all these things because you should follow your instincts, your dreams. And so my advice is, yeah, it's not an easy road, whether you're going to go your route or my route. There's going to be organic chemistry comes to mind. There's going to be all kinds of roadblocks,
Yeah.
but have that determination, that fortitude, to just push on. Like I remember I was at home for college. I would talk to my mom and say, "This was the hardest test I ever took. I'll never get into medical school. Forget it." And she said, "Did you do your best? Don't worry about it." Okay. And I think that's great advice. So if you do your best, and sure, there's going to be obstacles always, but follow your dreams. And if that's what you want, don't let anybody convince you otherwise.
I love that. Well, Doctor, this was amazing. And I want to say thank you so much for taking the time to speak with us today. Where can people look up more about your information or find your books?
So the Everyday Medical Miracles is it's basically it's book baby publisher. So that's store.bookbaby.com or Amazon. It's Barnes and Noble, and similarly, the Expert Guide to Fertility is Johns Hopkins University, but readily available, and it's also Kindle, and there's also an audio, I should say, version of it, and that's on Amazon and so on. So I do find I tell patients, to think about the book. Sometimes I feel a little uncomfortable, because I wrote the book, but realizing that, for instance, Dr. Colleen Smith comes to mind. Her statement is, it makes her job easier
Yeah.
because the modus operandi, the way each subject is approached, is what you guys do, okay? What acupuncturists do, what reproductive endocrinologists do, and it helps everybody who's providing care because the patient understands better,
Yes.
what to expect and what questions to ask. And so I like to think it's win-win.